One of the common reasons why people seek rejuvenation surgery is for their eyelids, because it is actually one of the first areas that shows signs of age as we get older. The upper eyelid specifically gets saggy. And so when it becomes a little bit saggier, people feel a little bit maybe less vibrant and look a little bit more tired. Hi, I'm Dr. Peter Lee, board certified plastic surgeon here at Wave Plastic Surgery, the world's leading clinic. Today, I'll be talking about upper blepharoplasty, which is another term for that is an upper eyelid surgery, who are ideal candidates for it and what that procedure involves. So what is an upper blepharoplasty surgery? Usually involves a component of two things: taking out extra skin that becomes loose as we get older, as well as removing some of the fat that kind of like becomes a little bit loose and puffy that adds to that heaviness in the upper eyelid region. So who are good candidates for upper blepharoplasty? As we get older, our upper eyelid starts sagging. And it sags because of two reasons. First, it's the looseness of skin that occurs in the upper eyelid, as well as the forehead starts sort of drooping down. And as a result, the eyebrow itself becomes more sort of like down. And as a result, everything gathers in the upper eyelid. For some people, they're good candidate for taking out the extra skin in the upper eyelid. For others, it's actually elevating the eyebrow back to the position that it used to be. For some people, it's actually a combination of both. Another thing that occurs as we get older around the eyes is not just about sagginess of the skin in the upper eyelid, but it's also the laziness that occurs in the way that we open our eyes. Just like skin, our muscle also becomes a little bit more attenuated or stretched or loose as we get older. And therefore, the muscle that we use to open our eyes become a little bit weaker and stretched. And as a result, people will say, I think my eyes are becoming a little bit more lazier, or my eyes became a little bit more sleepier. And that occurs because that muscle becomes a little bit weaker. So in some patients, as we're doing the upper blepharoplasty, not only are we taking out the extra skin, but also tightening that muscle as well, so that their vertical aperture, the amount of eyes that opens up, becomes more noticeable. What to expect before, during, and after surgery? Before is actually the most important. It really is to identify exactly what the cause of that heaviness of the upper eyelid really is. For some patients, it is because of the looseness of skin. For some people, it really is because the eyebrow has descended down as we got a little bit older. During the procedure, if we're doing an endoscopic brow lift, what we're doing is that we're making small vertical incisions, usually about 1.5 centimeters behind the hairline. Usually we do use 5 incisions, one centrally, one on either side, and one on each side of the temple. And through that incision, what we're doing is that we're inserting a camera. That's why we call it endoscopic brow lift. So we're inserting a camera that helps us dissect and free and elevate the entire soft tissue of the forehead and the temple. Centrally, we're elevating it more vertically. Off to the side, we're doing it a little bit more diagonal direction to get rid of that, what we call the lateral hooding that occurs as we get older. The endoscopic brow lift surgery is relatively quick. It takes about 45 minutes to an hour. The great thing about endoscopic brow lift is because we're not touching the eyes, it looks very natural for people that really just require that re-elevation of the brow to its normal position. For a lot of patients, it's really not painful after surgery, minimal swelling, and usually in about 7 to 10 days, they look very natural. For people that require upper eyelid surgery, we do have to make an incision along the eyelid crease. We usually do it under what we call IV sedation with local anesthesia, which means through an IV, we give them a little bit of medication to kind of relax them. And then we use local anesthesia to do the surgery. During the surgery, we do require patients to help us to kind of like elevate their eyes so that we can kind of obtain the symmetry between the two sides. The surgery is about 45 minutes to an hour. There are stitches that we take out after about 10 days. And for most patients, they look quite natural after about 2 weeks. There are a variety of options available for the sagginess of the upper eyelid. And therefore, it's really important to have an in-depth consultation with a board-certified plastic surgeon. For more information, please visit worldsleadingclinics.com.